Despite the fact that approximately 1 in 3 women will get vaginal thrush in their lifetime, and many will experience recurrent infections, it is still something we rarely talk about. We spoke to an expert, Dr. Chris Beer, about a new study regarding vagina health, and what all women ought to know. Chris Beer told Mamma Mia the most telling symptom of thrush or candida is a thick white discharge, with a cottage cheese-like appearance. Other symptoms include: interestingly, the incidences of thrush have skyrocketed in recent history, with the introduction of things like antibiotics. 30% of women will get thrush because of antibiotic use, the contraceptive pill, chemotherapy and refined sugars. The recent rise in active wear as everyday wear is also thought to be a contributor, as it doesn't allow for necessary ventilation. The same rule applies to non-cotton underwear. Soap products used on the vulva or in the vagina can also cause thrush, as it disrupts the natural phase of the vagina, and alcohol is also a known trigger. Listen, don't put soaps anywhere near your pink bits. Post continues below. Thrush is more common in women in their 30s and 40s, and pregnant women. Dr. Beer added that a suppressed immune system can sometimes be the cause, especially for recurrent infections, along with being stressed and run down. We've now realized, Dr. Beer told Mamma Mia, there's a link between your vaginal health and your gut health. If someone's diet is really high in refined carbohydrates and sugars, there is a link there, and it can actually change the flora of the vagina tract and cause recurrent thrush infections. Ideally, you shouldn't self-diagnose yourself with thrush, especially if you've had thrush in the last 6 months and treated it successfully. You are worried you might have a sexually transmitted disease, there's a smelly discharge or bleeding, or you're under 16 or over 60. In such cases, it's important you see a doctor. The doctor will either have you describe the symptoms, or will take a quick swab and test the cells. It's completely painless and nothing to worry about. Symptoms of thrush can sometimes be quite similar to bacterial vaginosis or trichomonas, although those conditions often come with a fishy or offensive smell. A variety of treatment options are available, from tablets to pessaries, a cream inserted vaginally. Most can be purchased over the counter, with no prescription. Often, 1 tablet is all it takes to cure a bout of thrush. Cest oral or diflucan, yet can have some, very rare, side effects like diarrhea or vomiting. Creams, Cest or exostatic, do not come with side effects. Technically speaking, yes. Thrush is not a sexually transmitted infection, however, there is a risk your partner can contract thrush. This means they might have some redness and irritation, but Dr. Beer explained, it's self-limiting and it normally goes away in a day or 2 because it doesn't have the internal environment women do. For some women, thrush might make sex uncomfortable or painful, because the area is already irritated. It's also important to note that cream treatments can weaken condoms, so it's best not to apply right before intercourse.